All right, so welcome to another episode of the Sports Vision Pros Prospective. Tonight we're extremely fortunate to have a good friend of mine and an amazing person on the video conference with us. We have Mr. Eric Waters, the head trainer with the Utah Jazz, who's been around the NBA for about as long as I've been an eye doctor, probably a little bit longer actually. Very experienced and extremely fantastic individual, but we're thrilled to have him here. We wanted to ask a couple of questions specifically related to the relationship between optometrists and athletic trainers. Also get into a little bit of the specifics of professional basketball and just basketball in general related to vision. But Eric has some amazing experience back to multiple different sports through the Olympic programs and things like that. So I'd like to do a quick introduction for Eric and have him talk a little bit about what he's done in the past with sports, and then tie it into kind of what we're all talking about on this website. So Eric, it's a pleasure to have you, my friend.
Thanks, Keith. Appreciate it. Kind words. Well, background, I don't want to go too far back because I basically have just been working in the NBA the last 17 years. So starting my 17th season, I guess, in the NBA. So I met you that long ago and started what I consider that you brought to our program, an in-depth approach to sports vision like I've never experienced anywhere else. So been fortunate to have that exposure. So appreciate the time to chat about it. Yeah.
So, I mean, look, it's been my pleasure, and from a sports medicine perspective, the bell that's been rung by sports vision specialists for 50 years has been that, we might be able to do something to help you play better. And in my experience, and this is something that again, Eric and I, with our long relationship, we've seen a lot of players with big contracts that have been signed to max deals in the NBA that, once you reach a certain status, a certain point, you've sort of achieved your pinnacle. So if you have a young upstart doc or somebody that, maybe you don't have the relationship with because you're new to the team, coming in and saying there's something I can do to maybe make you better. Well, how much better are you going to make me? I just signed a $120 million deal, right? So, I mean, there's some of that. I think that there's always, what can you really do to make me better? And you build the relationship, you build the trust, and then maybe that door opens a little bit. But I think for me, the other angle that now has been something that really I think we can also stand on as a platform from a sports vision standpoint is the injury prevention road. So, there's, I think, a lot of studies and research ongoing and things that have been published already talking about potential injury avoidance and injuries that could have been related to deficient visual skill sets and such. So I'm going to ask Eric a little bit on what he's heard from a training standpoint, because we've related a couple of studies from a vision standpoint that come out through the ophthalmology channels. But what have you heard specifically through athletic training standpoint and studies relating potentially to injury prevention in visual skills?
Yeah, I mean, there's some interest in vision's role. I mean, visual spatial role in injury prevention in terms of, for instance, there's been some talk about, specifically in a few of our sports and within the NBA, losing guys to ACL injuries and some of these guys make movements in landings, jump landing tasks where they've done it thousands and thousands of times, but the one time they may tear an ACL. Why is that? Well, some of this, there's some data to show that these guys are looking in a different direction than and not paying attention to what's in front of them or below them when they're landing. And this is when they're having, a knee abduction moment where they tear an ACL. I mean, there's all sorts of avenues there with visual spatial awareness and how it plays into proprioception and injury prevention, whether it's an ankle sprain or a more severe injury like a knee injury, an ACL tear or something. There's a long way to go. We have a long way to go in exploring that stuff. So.
Well, I think one of the frontiers that Eric and I have worked closely together on too is a lot of situations of concussion recovery, right? And optometry's role and vision's role in helping, in part of being that integral part of a rehabilitation team for athletes in concussion. And I believe you've talked quite a bit about that in the past too, Eric.
Yeah, I mean, there's a depression of all the stuff I talked about after concussion. There's a new study out recently. I can't remember who the author is, but you can find it. It's really intriguing. Post-concussion and its effect on proprioception and visual spatial awareness and how that's that plays into injury and trying to recover from injury and recovering from concussions. That stuff stays depressed unless you address it, and that's some of the stuff that you've brought to us when we've had those kinds of issues. That's been helpful.
And what's the current thinking as far as, NBA circles and training in general, as far as the immediacy or how early you can refer a patient with a concussion with vision-related symptoms in for some therapeutic intervention? I mean, long ago are the days of sitting in a dark room and doing nothing. We all know better than that now with the Berlin conference and everything with what we know about concussion. But what's the thinking in your current, NBA, concussion protocols and circles as to when you would pick up the phone and reach for some intervention, from a vision standpoint?
I don't think there's a consensus, to be honest. And I can just tell you my own personal opinion would be as soon as possible. You want to get them you want to have them evaluated at their lowest point, in my opinion, so that you can track progress. I feel, and not only that, but a baseline testing, like some of the baseline testing you do, so when they're normal again or when they're back to their own baseline and whether you can go past that. So I would say right away, as soon as possible, next day, as long as they're not feeling awful. I think I would defer to you guys, but the thinking would be all over the place, to be honest. If I were to ask my colleagues, you're the ones that probably have a much better handle on when you should be seeing these guys.
Well, and what's funny, Eric, I mean, from an optometry standpoint is, when I was in optometry school, which, seems like, many moons ago, but, vision training and vision therapy in sort of its core sense of, physical focusing skills and eye tracking and eye movements was actually one of those things that, was sort of such a fringe specialty that, core ophthalmology as far as, and core optometry would sort of look down on it as kind of, witchcraft or something that's, outside of scope of care. We fit glasses and contact lenses, and there's a couple of guys on the corner that might do some vision training, and it really was kind of an outside science, if you will. But I think the research in the study has certainly backed up the fact that there's credibility from visual focusing skills and physical skills that we can build from convergence in those issues, back to your point of, visual processing and visual spatial skills that, now you have concussion centers across the country. You have team physicians and team doctors that are actively reaching out for someone to do visual training in post-concussion situations where there's a visual component. So to me, this is something that, all of us, the three of us, Dr. Horn, Dr. Cunningham, myself, are trying to ring the bell to our colleagues to say, look, these physicians, these allied health professionals are looking for us, looking for a specialist to step up and say, I can do something to help, and just be ready to pick up the phone, because I think that's such a huge application and such a huge opportunity for our profession is to be part of that integral part of the team that, again, looking back, we would have maybe said, those aren't things we want to get involved in, but I'm telling my colleagues that people are looking for you. So if you're not fresh on those skill sets, go back and reacquire them. We've all been trained in that capability. So go back to it, because I think it's a truly important, role that our profession plays. And I think you made another great point as to the data collection and the quantifiable data that we can give back to our training staff, in that return to play progression, that we can help to make that decision as best we can without subjective qualities, right? So in the day was, how's your headache? Let's grade it on a score of 1 to 5. Let's go through the SCAT testing. Let's do all the things that we can do. But the more quantifiable data points that we can put into that discussion, the better we feel as a medical team, to let that player go through that progression and return to play.